All right, welcome again to the CareWare for Healthy Start Q&A session. Thank you all for joining us. We're going to go over the agenda for today's meeting and a few housekeeping slides before we get started. Next slide, please. All right, so again, we'll go over housekeeping and some ground rules for our Q&A session. Then we'll have a brief CareWare overview from Lena Barrett of the Division of Healthy Start and Perinatal Services. Then we'll go over some CareWare frequently asked questions with Lena and Matt. And Matt is from NICHQ. And then we'll open it up for our Q&A session, followed by a brief closing from Ken. Next slide, please. So this session is being recorded and we'll be posting it to the EPIC website for future viewing. All participants have been muted upon entry, and we ask that you remain muted to limit any background noise. But please feel free to use the chat box to ask any questions. Next slide, please. So if you can hear me, you're probably connected correctly, but just to go over this, if you click the audio button in the left-hand corner of your screen, click Join Audio, and you can select from phone call or computer. If you're using your phone, dial the number, enter your meeting ID, and then enter your participant ID. Next slide, please. If you'd like to participate using the chat, click the chat button at the bottom of your screen and a sidebar will appear. Make sure that you click everyone in the to field to make sure that you're sending your message out to the entire group. Next slide, please. Okay, so just wanted to go over some brief ground rules for today's Q&A session. As you know, this is an opportunity to ask general and common questions about the CareWare data system. And we want this session to be as useful for as many people as possible. So please try to keep your questions general. And if you have any very specific questions, please send those to the help desk at JPROG, which is our contractor who is helping us build the CareWare system. So any very specific questions should be emailed directly to them, and their email is hshelp@jprog.com. And today we'll only be discussing CareWare. We will not be discussing HSMED or the Healthy Start data collection forms. So if you do have any questions about HSMED or another topic, please save them for today and instead email to them to healthystartdata@hrsa.gov. All right, next slide, please. So now I'll hand it over to Lena Barrett from the division, who will be providing the CareWare overview.
All right, could you send it to the next slide, please? Just to briefly introduce myself, my name is Lena Barrett. I'm a project officer in the Division of Healthy Start and Perinatal Services. I'm also on the data and evaluation team, and I am helping to oversee the CareWare project. So the next few slides I'll go over, you all have probably seen a few times if you've come to any of our presentations regarding CareWare. The first one was during the Healthy Start grantees meeting. So I just want to reiterate, set the context again before we jump into really asking our frequently asked questions and going over those. Really why the division decided to develop CareWare and really customize it for Healthy Start. So given the complexity of the different reporting requirements in the Healthy Start program, we wanted to provide, the division really was looking to provide more resources to grantees. So I think it's been a long, and Ken can speak to this later, it's been sort of a little passion that we be able to provide our free resources to grantees to help meet those data reporting requirements. So being able to provide CareWare, a free data system that's going to cover all of the needs of Healthy Start grantees, was really an excellent opportunity that came to us in the last year. So we were really looking forward to help provide more resources, more support in terms of reporting the required data, and then additionally an opportunity for us to improve the quality of data across all of our programs. You can go to the next slide. So again, just some benefits of CareWare to go through briefly. It's no cost to grantees. It's free to use. We have all grantees organizations loaded up in it, so you can access it at any time. It's live. It went live on August 14th. So you can absolutely get into it. We hope you've come to the session having been able to play around with it a little bit, at least look in there, see what is available at the moment, and bring those questions that you may have to the session. Again, CareWare is a tested long-term HRSA investment. It was developed out of the HIV/AIDS Bureau and has been in development for over the last 20 years. So it's really become a really highly customizable data system that allows grantees to create their own custom forms, create their own custom reports, and we have a number of resources available to grantees to really help guide them through how to do these things. So again, it's just a long-term investment that we know is going to be around for quite a while and has proven to be an excellent resource, not only to the HIV/AIDS Bureau, but to 2 other bureaus within HRSA. You can go to the next slide. And again, through the development of CareWare over the last 20 years, it's now browser-based, so a grantee doesn't need any additional software or to download anything to use it. It's completely hosted within your browser. The only browser it does not work with is Internet Explorer, so if you've been using Internet Explorer and having issues there, you may have to use a different browser. You could use Microsoft Edge. That's the new browser for Microsoft. Chrome works, Firefox, and Safari if you're using Mac. Additionally, as I went over briefly, CareWare is a highly customizable system, so you'll be able to create your own custom reports and things like that to track your data how you like. Additionally, HRSA, we are working to develop all of our required reporting in it. So at the moment, you have access to the monthly aggregate template. And then additionally, we will be building in the report for the performance report and then a benchmarks report for your progress report. And then from there, grantees are able to customize any types of reports or forms that they would like as well. You can go to the next slide. Okay, so now we're going to go ahead and jump into, we wanted to first go over some frequently asked questions that we've received. And again, this session, we really want to keep the questions more general. If you're having a really specific issue, so for instance, if you've been locked out, or if you have a question about how your site might do something specifically in CareWare, we want you to go ahead and email that hshelp@jprog.com email address. That's our help desk. The developers of CareWare, JProg, they'll be able to provide you a walkthrough of those things, help you out if you have issues signing in or things like that. And then additionally, if you have broader questions that are really more about data collection or more about the HSMED or some other things, I know these all are a bit intertwined, but if they really are about sort of those other reporting systems we have, we'd like you to email those to the Healthy Start Data at HRSA.gov mailbox, and then we can answer those specifically there. So we'll go ahead and jump into some of these frequently asked questions. Me and Matt will go through them, and then we'll go ahead and open up to questions if you want to chat them into the chat box. So you can go to the next slide, please. Matt, would you like to go over this one?
Absolutely. So hello, everybody. So what you're looking at here are just some information about how you can actually access CareWare. I think some people have had a little bit of a challenge locating the URL. That is the same URL for everyone. So whether you are a grantee working in California or a grantee working in Massachusetts, you're still going to enter your CareWare provider instance through that URL. And then there's also a very helpful CareWare page. I know there's a lot of content on that one, on the EPIC webpage, but that's going to provide a lot of detail as far as where you can how you get to that link, some information about CareWare as an overview, a CareWare FAQ, which we had sent out, I think a couple weeks ago, which would have answered some of the questions that had come in by that point. As well as the user guide, which is something that is evergreen. Like we're continuing to work on that, and we will be posting updates and making an announcement about that to you when they're ready. And then the last part is this user license agreement. So the platform, there's a sort of a generic user license agreement that's not specific to Healthy Start, and that by using the system, it is implicitly, you are implicitly agreeing to that user license. And so you're encouraged to look that over as well.
You can go to the next slide, please. So another general question we've had, how do I access my login information if I'm not a project director? I'll go ahead and give Matt a few minutes to go over this, but just generally when the site went live on August 14th, all project directors were emailed their login credentials, and we did choose to have user accounts managed through the project director. So your project director needs to log in and then go ahead and create those other staff accounts. Matt, would you like to go over that a bit more?
Yeah. So this actually, I think this comes up a lot when for people setting up their initial accounts and trying to get access initially, and sometimes passwords not being correct, and then it might go back to what Lena was mentioning about Internet Explorer. Sometimes you can get locked out. So what we decided, as Lena was mentioning, is that for purposes of confidentiality and just and sort of to ensure that we can manage this system for all grantees, the initial account was created for the project director, and if your project director, who in the system would be the provider administrator, has not received that that information, the login information, you can certainly reach out to careware@nhq.org for some information about that. But that project director would create the subsequent user accounts for others on their team, and would also be assigning user groups. So if you had participated in that earlier training, or if you have the user guide in front of you, section 3 is going to be the relevant section that will help you to understand how to create user accounts, how to manage them, and how to assign different levels of permissions depending on what their responsibilities are.
You can go to the next slide. Another question we've received a lot, will grantees need to execute any contracts to use CAREWare? No, there's no contract required to use CAREWare. As we mentioned a bit earlier, there's an end user license agreement that is available for download from the Healthy Start Epic Center. The link is there, and then you can see highlighted yellow at the bottom. It's number 4. You can access the license agreement there right on that page. And so again, it's implicit. If you use CAREWare, you're agreeing to these. So it's a good idea to just download it, take a look through it, and see what's in there. You can go to the next slide. And then are all required reports supported by CAREWare? Yes. So right now, what's available in CAREWare is the monthly aggregate report. We went ahead and built that since it's a monthly report that needs to be done. The next set of reports that are required reporting for Healthy Start that we're working on are the performance report. So we know that is usually around July. So we'll be looking in July next year. We'll already have it rolled out by then when you have to do your performance report. And then we'll be looking for a benchmarks report that tracks the 19 different Healthy Start benchmarks. And that is generally used for the progress report. But of course, we know it'll be useful to grantees on a month-to-month basis so they can really keep an eye on how they're doing with their benchmarks. So those two, the performance report and the benchmarks report, we're working on right now, and they'll be rolled out. We're aiming for January 2021 to have CAREWare sort of completed. Matt, is there anything else you would really like to speak to about that?
Oh, just that the CAREWare support help desk support team can assist with building custom reports.
Great. So you can go to the next slide. And then I will let Matt go more in depth with this if he would like to expand. Will CareWare feature any additional forms? So right now when you log into CareWare, you should notice that you have access to the 3 Healthy Start data collection forms. So that's for screening of the clients. So those are in there. And then over the next few months, we are working to develop some additional case management modules that really speak to the other types of information that grantees need to collect on clients to really appropriately manage their cases. So we have a list of them, the types of modules that we're building right now, and we're doing that with grantee input. We have a work group we've put together. So examples of that would be general enrollment information, some demographics and family information modules, additionally an area to track home visits and case notes for those home visits, an area to track screening and assessments and referrals and other types of services, an appointment tracker that would track things such as prenatal care, as well as well-woman visits and things like that, some general health information, and then a more supervisory type case management module. So anyone who may be a supervisor can quickly go and look through caseloads for different case managers and things like that. We already have something built in, just a general document upload. So you could upload, for instance, if you have certificates from educational classes that they may attend, that different participants may attend, you could upload those to their file and they can keep them in there. And then a care plan, that'll sort of be the last piece that we really roll together. So right, as I mentioned, we have a work group we put together of grantees that are really helping to build this. Matt, would you like to speak more to that?
You did a great job, and I think the only other part, yeah, and just the only thing that I just to clarify too is we will be rolling these out in modules, so in collections of forms, and so there's sort of an ongoing process that we're working through with the work group to prioritize and to implement those forms, ultimately to test and then release them.
Great. Next slide, please. And another question we've received a lot, how will the aggregate report use the data from the data collection forms? And I think I just saw something similar to this in the chat. So grantees who choose to transition to CareWare are responsible for entering data collection forms so that they can produce their monthly aggregate report. The monthly aggregate report tool will compile the required data from the data collection forms and generate a completed Excel file that matches the aggregate report template. So with the latest revised aggregate template, a data dictionary was also released. And then you'll notice in the data dictionary that it has lists of sources where to find specific indicators within the Healthy Start form. So what questions those indicators are really matching to. So that's what CareWare's aggregate report is built off of. So it pulls that information from the data collection form to generate that file. Then the grantee will download that Excel every month and send it to their project officer with their project officer CC'd, and send that email to the Healthy Start Data at HRSA.gov mailbox, just as we have been doing. And again, the due dates for those are on the 10th of the month. It begins through the last day of the month. Next slide.
Yeah, so I can take that one. So does the information entered into the data collection forms auto-populate? And so this is going to be important for some of those custom modules that are these custom case management modules and forms that we're going to be rolling out. But yes, any information that you've entered into those 3 data collection forms will then populate in other fields. So, you know, like I'm trying to think of an example. An example will come to me. But when we are rolling out the additional case management modules, same kind of thing. So there might be a form that is referencing a birth date, and as long as we have that birth date or that information collected via the other primary method, we'll be able to access that information in the subsequent forms.
Next slide, please. And again, we'll get to the questions in the chat. We just wanted to get through some of these general FAQs. We're almost through them. I think we have a couple more. Will CareWare have the ability in the future to import files from another case management system? So I know a lot of grantees are curious about what time saving can really be offered by CareWare in terms of getting the current clients into the new system. So CareWare has limited functionality just given the many different types of data systems that grantees use. So the real functionality to import data is limited. There are some options for importing that data. And then additionally, in the future, we'll be exploring some additional options about how to import data collection forms that may have been entered into different systems. So right now, if you are curious about importing your data, what you need to do is email hshelp@jprog.com, and they can really talk you through what your options are for importing. So how we might match indicators, whether we would do that with an Excel sheet, it really just varies depending on what data system your site is currently using, and then how the CareWare system is built as well. So we do have an import tool, but it is limited in terms of what it can bring in from a different type of system. So if you work with hshelp@jprog.com, or you could also call the help desk if you'd like to talk on the phone. We have the hours posted in the chat, and then additionally it's listed on the FAQ and the CareWare one-pager that's available on the Healthy Start Epic website. So you can contact those two places to be able to find out what the options are for the grantee. And then just one more note to that. So each grantee is responsible for developing their approach to transitioning to this data system if they choose to use it, which would include plans to meet program reporting requirements while you're transitioning.
And just one last comment about that. For importing data, the CareWare team, the JProg CareWare team does have a lot of experience doing these kinds of imports. So definitely you'll be able to work with them to at least sort of understand what your options are.
Next slide, please. And then in addition to importing, we've gotten a lot of questions about exporting. So can client level data be exported so it can be imported into another database? More generally speaking about exporting, grantees can export any data they have entered into CareWare, including client level data entered in the 3 Healthy Start data collection forms. So there is an export tool. You can pull down any information that you have put into there. Additionally, we've mentioned before, there's a reporting custom reports tool. So you can create kind of custom reports, and if you don't want to pull it all down into Excel and massage it somewhere else, you can create your own report that you would like in CareWare. And again, if you need help with that, you have questions about how to do that, you can contact the hshelp@jprog.com address.
And I just wanted to jump in with, I was actually just talking with JProg this morning, and they're looking forward to helping with helping grantees as you are developing your own custom reports. There is a feature, as Lena had mentioned, called that where you can export. We can dump the entire database, but ordinarily that's not going to be something that. So you can get all of the data, and it wouldn't just be arranged in a flat CSV file. It would be arranged as an Access database file or an XML file. But ordinarily, what you're probably wanting to do is to pull down data for specific metrics or otherwise, and to do that, there is, as Lena had mentioned, there is that that tool, the custom reports tool in the system, and the JProg team is ready and excited to help you with that. Thanks.
Thank you, Matt. And then we'll go to the next slide. Okay, Matt, this one is for you.
Yeah, so this has come up, and certainly it comes up in a few different ways depending on the structure of how grantees are structured. But there are cases where grantees might have 2 sub-grantees or sub-contractors working just beneath them. So right now, the CareWare system only has that parent level grantee, so that primary grantee is in the system. But one of the things we're working out is likely going to be creating additional providers or provider grantee entities, so that when you log in, you have an option to either view the data at the grantee level, or you can assign and manage user accounts at the subgrantees. And then part of that assigning users would be assigning them to be, assigning maybe there's somebody who manages a subcontract and you want to give them the permission to be able to manage the data themselves and manage their own additional users. So in short, we will be creating additional providers or grantees that you will then manage at your primary grantee level. And more information about that to come, and hopefully a more clear answer.
And then I believe we have one more question that we'd like to cover. So next slide. Thank you. And then we've received a question from a few grantees. Can I use CareWare for my other program? So if you plan to use CareWare for Healthy Start, and perhaps you have another home visiting model that is also under your Healthy Start, you can create custom forms to track the other data and different programs and to track those clients within those. That said, given the extent to which the data system really has been customized for Healthy Start, if you want to use it exclusively for a different program, if you have nurse-family partnership and you would like, you're looking for a system for them, we would not recommend that CareWare be used in that way. And then additionally, because CareWare is supported through Healthy Start funds, it must support Healthy Start activities. So it's not really within the purview of that to support reporting for a different program. Not only is it sort of an ill-created tool for that purpose, it really does, if you're trying to use it without using it for Healthy Start activities as well, that really falls outside of the purview of what CareWare is intended to do. And then I guess, I don't know what we have on the next slide. I believe that's it, and then we can pause here and yes, go into the Q&A.
Great, thank you so much for that. So we're just gonna go through this chat box. Looks like a few of these questions were already answered. Okay. Will HRSA provide CareWare training for end users such as Healthy Start home visitors?
So at this time, we do not have plans to provide training for grantee staff. We do have some recorded sessions where we have some really general information on how to get into the system. Additionally, we do have some user guides and quick manuals. We have been talking about, though, exploring additional types of trainings for grantees, especially since we have a number of different systems going on this year and things like that. So I would say stay tuned. At this moment, we do not have anything scheduled, but it is definitely on our radar. And thank you for expressing the need. That gives us a good idea of what grantees really need. And so gives us a good case to make when we're talking about what types of trainings we may have.
Great. I believe the second question here was answered. So are grantees expected to enter data into CareWare for all clients enrolled as of January 1st, 2020? Or only clients enrolled since May 15th, 2020?
Sure. So it's going to be up to each grantee how they transition to CareWare. So really, that is going to just be dependent on your site and really what your plans are for transitioning. It may make sense for some sites if they have the data, if they have the capacity to enter all that information and they just want to start with, from the past year, it may make sense. But additionally, and I did see a question about this, in terms of making my aggregate, filling out my aggregate report. Well, you may want to, if you're kind of straddling two systems at the moment, you may want to quote unquote freeze your monthly report in the month that you decide to transition, and then only enter new clients into CareWare from the time that you do decide to transition, and then just add those numbers into the aggregate reporting template and continue to build off that. So it really is going to be up to each grantee how to transition. It's just going to be dependent on the resources that you have available. We very much recommend that you create a plan. You have assigned staff that are dedicated. You create timelines. We have been asked, when does HRSA expect us to transition. We don't have any timelines. Again, CAREWare is not mandatory. It's just if grantees would like to use it, this is a resource. So again, it'll be up to you to create a timeline and to really project manage how you would like to transition. If you do have questions, you're struggling to create a plan, or you just would like some ideas, or you would like to ask us a few questions about the whole transitioning process to see if it makes sense, I would absolutely suggest that you reach out to the CAREWare email address that provides support. So our TA and support is split into two different branches. We have the programmatic type, which NicheQ provides. So I believe that's careware@nicheq.org. And then additionally, we have the more technical side. So that's the JPROG email. So hshelp@jprog.com. And then again, if you have some more broad questions that are really about data collection or things like that, that's when you can come and talk to us directly at HRSA. So that would be the Healthy Start Data at HRSA.gov mailbox. Again, all these email addresses, we have all of the TA and support ones listed in the FAQ. And then we have them throughout this presentation, which will be posted and recorded to the Healthy Start Epic website. But again, in terms of transitioning, that'll just, it's very dependent on what your particular situation is and what your needs are.
Thank you. We have a few questions about the data dictionary. So first, can you confirm or clarify what the data dictionary is for, whether it's for CAREWare or for the aggregate report, and then where it can be found?
Okay, so the aggregate template data dictionary is for the aggregate report. So it's for that monthly aggregate report. So when I was talking about it, I was just saying that CAREWare used that to help build the aggregate report. So the data dictionary is specifically for the aggregate report. You can find that on the Healthy Start Epic website. If you go under the HS implementation, it's the orange, I'm trying to visualize it in my mind, it's the orange tab when you look at all the tab headers. And then you should go to the first one, I think it's the second drop down now that says data monitoring and evaluation. And so you'll find it right there.
Awesome. Okay.
And sorry, if we can get a link to that in the chat box, that would be excellent.
Yep, definitely.
Thank you.
Just scrolling through these questions. Do we have the option to use CAREWare to enter the data collection forms and aggregate data reports only if our organization already has a case management system for other data?
No, CAREWare is accessible to any Healthy Start grantee. So if I understand that question correctly, no, you don't have to have a pre-existing data system. Even if you did everything on paper, or you have your own Excel or an Access database or anything like that. However you do it, if you have data, you can use CAREWare.
So you can use CAREWare just for the data collection forms and the data or the aggregate report.
Absolutely. Again, we're building in additional support. We'll have the performance report come from there, and then additionally the benchmark report. So you'll have all of your reporting. CAREWare will be able to meet all of your required reporting needs.
Great. Is there a timeline for when the new modules will be deployed?
Sure. And Matt, if you want to jump in and talk a little bit about our process, we do have a work group of grantees that we are working on building these additional forms. We're looking to have it done in January 2021. So I'll hand it over to Matt.
Yeah, so we're going to be, we sort of have a phased review and test and hopefully launch schedule in mind, where approximately every 3 weeks we will be reviewing potential mock-ups, and then we'll be implementing those for testing. So you should see, that's certainly subject to some changes in the schedule, but you should be seeing periodic rollout of new forms over the fall and early winter.
And just a few questions I've seen in there that are just prescient to what we're talking about right now. The additional forms we're talking about are additional case management modules. So things like screening and assessments, where you can keep other types of screening and assessments. And then can we build our own forms right now? Absolutely. The custom form tool is in CAREWare, so you can definitely start looking through and seeing that. We do have a little bit of information in the user guide about customizing forms. And then again, if you would like additional help with that, you can contact hshelp@jprog.com.
And I just wanted to jump in there too. So one of the as Lena has mentioned previously, the platform has like 20 years of experience out in the wild and has been used for other HRSA projects. And so there's some features that we are going to be leveraging for this project that had been created for, prior to our use. In the same way, when we roll out new forms that are canned forms or forms that you can make use of, you may also consider how those forms either overlap with some of your existing, with some of the, maybe there's the possibility, I should say, that some of the new case management forms that we deploy might overlap with some of the other data collection forms that you might have had custom built in the system. And there's certainly ways that CAREWare, that JPROG at CAREWare can help you to resolve those kinds of those duplicates if they do arise.
Again, these forms are not mandatory. They're just additional case management modules that are really intended to assist grantees in collecting other information that's really useful for tracking participants. Again, if you just want to use CAREWare straight for reporting, you can do that. There may be some modules required in terms of creating your performance report, as the data collection forms do not collect every indicator required for those performance reports. So we can have some more information about that when we've developed these forms and really have a crosswalk for what is feeding into the performance report.
Thank you. Will CAREWare have built-in audits to monitor data?
So Matt, I'll let you speak to this as well. I'll just briefly touch on, again, you can create custom reports. So if there are specific types of audits you'd like to create, you can absolutely do that. Additionally, we're working with our work group in terms of exploring ideas for what other types of canned reports we may make that would be helpful to grantees.
Great. Matt, do you have anything to add to that?
No, that's great.
Okay. Can the import functionality be used now?
Yes, it can.
Awesome.
Yep, just recommend you, there is documentation out there, but feel free to just reach out to the help desk directly, and they can start working with you to get your data over, if or at least help you develop a process for doing so.
Okay. I see a few questions about whether CAREWare is required. So CAREWare is not required, but someone asked if there's a future where CAREWare will be required.
So at this time, no. I can't really speak beyond that. So CAREWare is not required, and just because I don't think so. I don't know, really. We would have to wait until the next funding cycle to really understand that. So CAREWare is not required. We don't foresee it in the near future being mandatory. It's just an option. It's a resource for grantees. You know, a way of providing a free resource, freeing up maybe some funds to do additional programmatic work without having to take on the cost of a database and then having to update it to match the forms and things like that, because we'll take that part on.
Thank you. Will folks be able to enter data from the Spanish forms into CAREWare?
Yes. Matt, would you like to speak a little bit more to this?
Yeah, so we are exploring whether so the data, the forms are, although the language would be different, the data collection fields are the same. And so we are looking into possibilities to accommodate Spanish-speaking data entry as well.
Great. Is it possible to see the details of the aggregate report to see who is being counted and identify possible data entry errors?
Yeah, so I think this is at this point, what you have in front of you with CAREWare, just as it's sort of at its baseline, is going to be that aggregate report, as well as the data collection forms themselves, where you can actually go through and view discrete data that were submitted, those data that were submitted for those forms. You might also want to, as we've mentioned previously, work with JPROG to develop your own custom reports that might pull out certain data that you are looking at in particular.
Thank you. Is there a way to link the moms and children in CAREWare?
Matt, I'll leave this one to you.
Yes, you know what? I would like to actually just if I can take that and spend a little bit more time giving you a more fleshed out answer, I'd like to do that rather than try to answer that on this call. But yes, there is the relations. Let me just hold off because there might be a couple parts to that.
Okay, thank you.
And I do want to, oh, go ahead.
Oh yeah, no, go for it, Lena.
I was transitioning, so you go ahead.
Well, I was just noticing that Patty had asked about the lockouts, and I think one thing I didn't quite explain very well when we were talking about setting up additional users and user permissions is that while we're getting set up and you have your project directors, maybe that's you, who are struggling to access CAREWare because maybe a password isn't correct or you've logged in too many times with the Internet Explorer and so it's locked you out. Whatever the case may be, if you need help resetting your password or unblocking yourself and you are that project director user, you can reach out to the careware@nitschq.org email address. What we can also do for you is to be able to help you resolve similar issues for other staff once you've gotten used to the CAREWare system. So again, if you're having trouble getting in, feel free to email careware@nitschq.org, and that's going to be Olivia and myself and Nikki, and we will be fielding those kinds of questions. But if what you need are more technical support at a more like immediate basis, then definitely refer to the CAREWare help desk, either by phone or by email.
Thank you. I see a question about adding a client, and I would recommend going to the user guide, which is on Epic, and we'll type in the link in the chat box. That user guide outlines how to add clients and enter data into the forms. And you can also watch the recording from the training on August 18th, which also outlines that process. And I believe sorry, go ahead.
Sorry, before we jump to the next question, I've seen a few times references to the HSMED schema. So that would be the client level export. So CAREWare will accommodate the client level export. What format that is dependent on the HSMED XML schema. So that's currently not released. CAREWare doesn't have it either. Nobody has it. So we're just waiting for that to be finalized. We're hoping in the next week or so that we'll be able to send that out to everybody so they can work with their data systems. They can work with transitioning to CAREWare. We'll also get CAREWare to accommodate that as well. So not to get too deep in the weeds of HSMED, I just wanted to address that. I know some of our data pieces are, of course, interlinked. So at this time, the HSMED schema is not released. Nobody has it. CAREWare doesn't have it. So we're just waiting for that so that we can create the appropriate client level exports for everybody.
Thank you. Patty asks, when we export client data, will it appear with codes or text such as yes, no, don't know, answer will appear as 1, 2, 3 or as text answers?
So that's the one I'm speaking to just a little bit with the HSMED schema. No, absolutely. Let me clarify that. So the actual codes that will come out, that'll all be dictated by the HSMED schema. It'll come with the data dictionary. So we're anticipating to have that in the next week or two. So once we have that, it'll be available to everybody as well as CAREWare.
Great. I believe I just went through all the questions. Nikki, do you see if I missed any? And if you have any other questions, we have about 15 minutes left, so feel free to keep chatting them in.
I do want to address a question I saw from Anna about having issues saving a form. So the first resource you can always go to is the user guide. It does have a section on permissions, but if you continue to have issues or you're just not sure how to resolve the issue or what issue you're necessarily having, please contact the hshelp@jprog.com email address, or you can call the help desk. You'll get to the same place. And they can help with your specific situation.
Thank you. And I just chatted in the NICHQ email address for CAREWare. It's careware@nichq.org.
Yes, so the question I just saw come through, sorry about that. Will HRSA build the HSMED schema in CAREWare for us so we can access it like a report? So once the HSMED schema is released, so that's from the HSMED data system, CAREWare and those are separate data systems. So we have different contractors for those. So once HSMED creates their schema and releases it, it will be given to all data system users, CAREWare users, so we can all implement that to create our client level download. So in short, yes, CAREWare will accommodate the client level download that will match the HSMED schema so that you can pull down your information and put it into the HSMED. So again, we wanted to focus on CAREWare in this meeting. I'll just briefly talk to it. HSMED is not going to be released until November 12th. So we'll have information on due dates, we'll have trainings, and we'll have data dictionary and information come out for all of that reporting.
Does the user guide explain how to remove permissions if we choose to do so? Matt?
Yeah, it does. And those permissions are granted by a group. So you'll see that the user guide explains that there are 3 different groups. There's the provider administrator, the data manager, I believe, and data viewer or report viewer. And each of those groups of permission contain a number of permissions. And so you're assigning or unassigning groups to individual users.
Thank you. Will CAREWare have the ability to alert people if a form needs to be completed or updated?
Currently, no.
Okay.
But that is certainly something for us to consider.
Can we clarify which questions should go to which email address? JPROG versus NICHQ.
Yeah, so you're always welcome to send them to both. Largely the technical questions, like you're not sure where certain things are, you need help with data migration, or you need to, you want to build a custom report. Those kinds of questions are going to ultimately be directed to the help desk. But while you're getting set up, if you have some of the questions that have come up, for example, on this call, actually majority of the questions that have come on this call would be good questions for the careware@nichq.org email address. So anything that's sort of getting at more of the Healthy Start programmatic elements, reporting requirements, etc., those would be good at the nichq.org one.
Thank you. Does the system have the ability to track eligibility, such as when a child ages out?
Yeah, I mean, I think that you'd have an active participant. I'm not as familiar with the data collection forms. I know that in some cases they are updated post participation, like after a pregnancy.
Mm-hmm.
in general, you will be entering, there are other areas in the system where you'll enter the date of birth for the child. So you will be able to know the child's age based on date of birth. The data collection forms do not collect date of birth just because they do not collect personal information. But there will be other parts of the system where you can enter that information and track that.
Great. Will there be further training on creating custom reports?
Yes, we do plan to do that, and I think our push right now is to try to get a sense of what's going to be most useful for the greatest number of grantees for reporting, and for these case management modules, and try to put together both the required reports and these additional case management modules, and then also at that point work with individual or groups of grantees to try to train on how to create custom reports. But again, just to reiterate, you are more than welcome to use that help desk email address to start getting going on some of those custom reports.
Okay. How does CAREWare generate the HRSA required identification number?
Yeah, that's a good question. I'm not sure. I'm going to log in and try and figure it out myself.
Okay. Looks like that's the last question in the chat box right now.
I do want to encourage, if anyone, as you're using CareWare, if you have any feedback that you would like to provide to us, that is a good time to contact the careware@nicheq.org email address. You can send us feedback there. We're working to improve what we have in the database. We've pulled together a work group. We really want to make sure that it's user-friendly for grantees and really meets their needs. Again, if you have any questions, if you have any comments or want to provide us some feedback, please do it there.
So I'm not having much success resolving that one question, but I think in addition to the other question I had mentioned earlier that I'd like to respond to outside of the session, I'll investigate that further and get back to you.
Thanks, Matt. Catherine, to your question, I think I missed this earlier, but another question made me wonder, are all three data collection forms in CareWare and can be used right away? Absolutely. So all three, the background information form, the prenatal form, and the parent-child form, those are available in CareWare right now. You can go ahead and start adding them in for your clients.
All right, we have about 3 more minutes before I'm going to hand it over to Ken. If there are any final questions, please chat them in. And yes, the data collection forms in CareWare are the most recent version.
Mm-hmm. And if you have any questions more broadly about data collection, the process, if you have questions about things that may be in the forms or things like that, you can always reach out to Healthy Start Data at HRSA.gov. That gets to us at HRSA directly, and we can go ahead and answer those questions there. Again, you can also always reach out to your project officer if you just have some general questions, and then we can work together with your project officer. So we all communicate pretty closely, and we'll make sure that the right person gets you an answer.
So Crystal, I've emailed that address. So I'm guessing you're referring to the HS help.
Or was that the Healthy Start Data? There was a time where we did chat in the wrong email address at one point. So just to confirm, it's healthystartdata@hrsa.gov.
Right. So, we've just been working through, again, that's accessible to all grantees. So we receive a number of responses there. So we are just working through them right now. If you haven't received an email, I hope you'll get one in the next few weeks. We are just working through as fast as we can to get to all the questions. Again, if you have a more urgent question, you can contact your project officer and they can assist more promptly as well.
So Debbie was just asking whether we were planning any future or further demos. So we're not planning any demo that's going to be just kind of the walkthrough that we did for that training the other day. But we will, when we have new modules to roll out, new case management modules or other features that are significant, we will host events to be able to demo those.
Okay. Well, if there are no further questions, I'm going to hand it over to Ken Harris from the TA and Support Center.
All right, thanks so much, Olivia. And thanks to both you, Lena, and Matt for a great Q&A session. And thanks to everyone that submitted those questions. There was quite a few that we were able to get through, as well as the ones in the chat. And again, I just wanted to emphasize those two different addresses as, again, with technical issues, that's definitely the Healthy HS help at the JPROG. And then again, more programmatic or any feedback you have, send it to the CAREWare. But as you see from Lena and Matt, we're all working pretty closely together. So if you send it to the wrong one, we'll make sure it gets to the right one. But just for you to kind of be guided, technical questions are the HS help at JPROG and the programmatic and feedback to the CAREWare. All right, so thank you again. Again, as Lena said in the beginning, this has been a long time coming for the Healthy Start programs, really the desire to provide and anticipate providing this database for Healthy Start programs. And so it's great. And we appreciate all the questions and everyone's involvement at this time to really help us kind of perfect the system. So we'll continue to work together. And the goal, again, you've heard it over and over, but it's really about improving the quality of data across the board for everyone. And it's great to be working in partnership with the Healthy Start grantees. And so we're looking to that CAREWare work group, who's Matt and Lena are working with, and looking for their help and to continue to guide as we roll out this data system. The TA Center will be here to help you and support you in any and all ways, especially around customization that's needed by grantees. And so if you have a question, just ask, and however we can support you, we're committed to doing that. And this is about data collection, but as you've also started to hear through today's conversation, it also, the database, like many databases, can also be used as a data management tool. So as you think about customizing your data systems, it also can help you locally with data management between your staff and your perhaps subcontractors if you have it. So we look forward to building future trainings with you as we heard some ideas today. Again, we're gonna keep our ears close to hear the needs that are out there with regards to training, and the TA Center certainly will be standing ready to put those trainings together that meet the needs of grantees. So thank you again for today, and thank you for your support as we continue to work together to build out the CAREWare system. Back to you, Olivia.
Great, thank you so much. Well, that's all we have for today. So again, if you have any questions, please send them to careware@nhq.org, hshelp@jprog.org, or the Healthy Start data inbox. And again, descriptions of who should receive each question is posted on Epic. So if you are ever unsure who to send a question to, just visit Epic and it will have all that information there. So thank you so much for joining, and we hope you have a great day. And thanks to Lena and Matt for this helpful session.